coming to us, which we are always glad to be able to talk about, because it reminds us that there are people with problems, and we often have the solution that is going to help them. And we often get very good feedback about what you find as a result of the recommendations that we make. So welcome once again, and so let's get on with today's Q&A. Just to say that we'll be having quite a number of Q&A for the remainder of the year, so that we do not have a backlog as we finish the year. So the first question I have today has been asked quite a number of times, and it comes from people living in East Africa, where malaria tends to be endemic and quite a problem. So I think we had this question in maybe the previous Q&As, but as always, we believe that repetition is the mother of learning, and as you know, in our business, we are always learning and finding new ways to deal with the issues that we come across. So once again, to repeat, sometimes the malaria germ will hide and lay dormant in the liver and get reactivated, so that a new attack of malaria may not actually be a new infection, but a latent infection that had been hiding in the tissues of the liver. On the other hand, of course, if you're living in a malarial area, you can get reinfected by getting exposed to the germ that causes malaria through the bite of a mosquito. So my recommendation for this severe malaria question is, first of all, to discuss with your doctor the medication that will be able to attend to this specific problem, because remember that malaria is actually caused by a pathogen, which means the first thing we need to do is to fight that pathogen and kill it. And so a discussion with the doctor, maybe mentioning that the malaria has been recurrent, or if the malaria has been severe. Sometimes, because we frequently get malaria, we may get in the habit of buying over-the-counter tablets for malaria, which may be okay, but if you notice that the illness is getting severe and the person is not improving, I strongly recommend a visit to the doctor or hospital, so that they can deal with this. Also, just to say, for the drugs often prescribed for severe malaria, it is important to take them until you finish the entire course, because sometimes when we feel a little bit better, we may decide to stop taking the medication. But that is how the malaria pathogen can continue not being cleared out of the body. So once you discuss with the doctor and you've got your prescription, make sure that you take the prescription until you finish, so that to completely get rid of the germ. Then other lifestyle things that I would like to recommend is to use mosquito nets and mosquito repellent, in this way to reduce the chances of being bitten. And then we also recommend draining stagnant water, maybe that is within your area where you can do something about it. There are some plants which have been found to be repellent to mosquitoes. So you can plant them around your house, or if you're living in a flat, you can plant them in pots. This may play some role in reducing the exposure. Our supplements will also help in especially clearing out the remains of the pathogen that might still be hiding in the body, and may also help to increase our ability to be resilient to the infection. So remember, this does not take the place of the actual anti-malaria medication. This is to support the anti-malaria medication. We recommend garlic allium complex. We recommend vitamin A plus D, and we also recommend vitamin B complex. So those will be a recommendation from the supplements as well as the lifestyle. And then going to the next question, again, this is one that appears fairly often, and this is someone wanted to know what to recommend for a person who has had a stroke and has had paralysis. So this, I think, was a paralysis of the arm. And of course, one thing to say is that once a person has had a stroke, it increases the chances of getting more strokes. Because we cannot do anything about the stroke that has already taken place, our main attention is in two ways: to prevent future strokes and also to try to regain anything that has been maybe affected as a result of a stroke. So in this case, paralysis, it may be some problems to do with vision, speech, and so on. So these are our main attempts. Once a stroke has taken place, we cannot do anything about it. But what we want to do is to minimize the risk of further strokes and also try to rehabilitate the lost abilities. I will also recommend in the lifestyle to consult a physiotherapist to help with rehabilitative exercises or massages and so on, to help with rectifying the issue that results from the stroke. And then we recommend lipotropic adjunct. This is from Neolife. We recommend vitamin E or wheat germ oil, and we also recommend Pro-Vitality. So these supplements are important for blood and blood vessel health. It's important that once someone either knows that you have a familial tendency towards clotting problems or strokes, or if you have had a stroke or a mini stroke, to make sure that you're supplementing with the lipotropic adjunct, vitamin E and wheat germ oil, and Pro-Vitality. Just to keep in mind that if your doctor puts you on blood thinners, you need to let them know that you're taking vitamin E or wheat germ oil, because and the Pro-Vitality, remember, has omega-3. So these tend to be blood thinning as well. So if your doctor puts you on blood thinners or prescribes blood thinners, it is important to let them know about this, because they may emphasize work of thinning blood, and your doctor needs to be aware so as to adjust your prescription accordingly. So from a stroke, the next question I had was about obesity, but there have been a number of these obesity questions. So what I'm planning to do is to put them together as a specific longer answer session where we deal specifically with the obesity issues. I am one of many people, I think, who is always struggling to maintain a healthy weight. So this is an area of interest to very many people. I include myself there. And so I think when we have this weight management Q&A, maybe what we can do is try to share in the chat the different things that we have found that helps with the weight management, because remember that weight gain and weight loss are active, so it would be a good idea for us to actually share with each other what we have found that works or what does not work. But so for today, I will leave this question about obesity and weight loss for another, probably next week or the first Thursday of December. Okay, so I go on to another question about persistent malaria, but in this case, it is an expectant woman in her second trimester of pregnancy. Here we notice that it's very important because we are talking about 2 lives which are endangered by malaria. So my first recommendation, once again, is to consult your doctor and discuss the safest treatment protocol for your region. Because remember that the strains of malaria found in different, maybe the one found in West Africa as a persistent or severe malaria may not be exactly the same strain as the one you find in Southern Africa or the one you find in Eastern Africa. So each region may have a specific medication that they recommend for this. And for the pregnant woman, of course, you need to make sure that you let your doctor know about this so that they also take into account the safety of the medication that they prescribe for anti-malaria. Okay, so once again, the same recommendation: use a mosquito net and mosquito repellent, drain stagnant water, plant mosquito repellent plants around your living space. And then, of course, the supplements we recommend will still be garlic allium complex, vitamin A plus D, vitamin B complex, and multimineral alfalfa. For this expectant lady, of course, we would be expecting to take the supplements for supporting pregnancy health. So the multimineral alfalfa, I added it there in this case because we may find that the woman may need a bit of a boost with the mineral supplements. So then going on, the next question was about an asthmatic child. And here, just to say that asthma is one of those illnesses that can actually be triggered or worsened by things that cause allergies, that is allergens. So it is important to try and identify what is triggering the asthmatic attacks in the child. It might be environmental pollutants. Maybe there is home care products that don't agree with them and triggers off their asthmatic attacks. It could be pollen. It could be other environmental pollutants, dust, smoke, and so on. So try to identify what makes the symptoms worse, and as far as possible to avoid them. From Neolife, we recommend VitaGuard because remember, this is a child. So we recommend VitaGuard to support their immune system because asthma has got an autoimmune aspect to it. So VitaGuard is going to assist there. Omega-3 salmon oil. If a child probably we will prefer that you use omega-3 minis because it's a smaller capsule that would be easier for a small child to swallow. And this will help with the inflammation that accompanies asthma and other allergic reactions. Then we also recommend herbal respiratory complex. If they are not able to swallow the tablet whole, then it is okay to split the tablet in half and give it to them. And if a child is under 12 already, we recommend that you give them half of the tablet, a full tablet. Then there have been actually a number of questions about hernias. So this is an umbilical hernia in a young child. And here, the hernia, remember, umbilical hernia is a hole that some children have in the area of the belly button. And the hole there, in most cases, it will close on its own, but it's not always the case. So it's a good thing to discuss with the doctor whether you should wait, continue to wait for the hernia to close on its own, or whether surgical intervention would be necessary. So this can be a discussion because it is not necessarily life-threatening, but it can be worrisome, especially as time goes on and it does not close on its own. So discuss with your doctor. And from Neolife, we recommend that you use Neolife Shake, chelated zinc that helps to heal internal wounds. And we also recommend vitamin C. In the case of a child, we recommend all C, which is easy for them to chew and swallow. The zinc can be either split or taken whole if they are able to do so. Then another question was one that I also received from time to time. There are people who are allergic to cold temperature. So coldness, they react to the cold temperature itself. And in this case, the first thing we recommend is that they avoid exposure to cold. They're using cold water for bathing or showering. And also they have to avoid getting rained on because this will cause an allergic reaction. We recommend a group of supplements that we usually will help with allergies. And this will be flavonoid complex, vitamin A plus D, and vitamin C. Another question was someone wanted to know if it is safe for someone with a fish allergy to use omega-3 salmon oil. So my answer here is will not be conclusive because it is quite subjective. Some people do not, most people do not show any adverse reaction. They tolerate omega-3 salmon oil well. But again, as I said, this is subjective. Some people may be very sensitive, and even the very small amount of exposure might cause an allergic reaction. So here, what I would say is maybe for the person to use the omega-3 minis and to try them for a while and see how they react. Or if it is your client, maybe you may give them a few for them to try and see if they have got a very adverse reaction or not. So again, it's not quite easy to know how someone who has got a fish allergy will react, but just to say that many allergic people tolerate omega-3 salmon oil well. Had another question from someone who wanted to know if the Neolife products can be sold around hospitals. And remember that our supplements are often quite usable in conjunction with most medications. And so here, what I would recommend is not to antagonize the hospital management, maybe to go in and speak with them and tell them what it is that our supplements do, and see if you can come to an agreement about how you can go about this. So again, here I do not have a specific answer, just to say that our supplements have got an important role to play in health, and it would be a good thing to create this awareness. There are many doctors who are very receptive about the use of supplements these days, much better than in former days. And so to go in and discuss with them, and that way you can get a clarification about how they feel in the products being sold, either around their premises or within their premises. Okay. The only thing that we have in Neolife is that the products may not be sold in shops. So a hospital is a place where people go by appointment, and it's not actually a place where people go shopping for medication. So for that reason, the Neolife side, there'll be no problem, but definitely we do not want to antagonize the hospital. So hence my recommendation that you have a discussion with the hospital management. Then several questions about GERD, that is the heartburn type of thing with gastritis, and these issues that have to do with hyperacidity in the upper tract of the digestive system. So we have some recommendations on the lifestyle side for GERD and heartburn and this type of condition, where we recommend avoid lying down after eating a large meal. In fact, it would be better to try to reduce your portion sizes, because the fuller the stomach is, the greater the chances of acid reflux, which is connected with GERD. Then we also recommend that you try to identify and avoid foods that worsen the acid reflux. Some foods make things others, so this again is subjective. So try to identify for yourself and avoid those foods that worsen the acid reflux. Then also limit the use of over-the-counter medications, which can actually contribute to acid reflux and even ulcers. So these are things like Brufen, aspirin, and so on. So minimize the use of this. And then from Neolife side, we have 3 supplements that we recommend. This will be chelated zinc to help with the healing of the effects of the acid flux. We also recommend the garlic allium complex, and we recommend aloe vera plus, which will have a soothing effect on the acidity. Some people find it beneficial to drink warm water with a small amount of lemon juice in it, to soothe to give a temporary relief to the heartburn. So rather than using some of these tablets, or the counter tablets that are recommended for heartburn, because in the long term they actually worsen the problem, better to sip warm water with a bit of lemon juice in it for a temporary relief. The supplements, chelated zinc, garlic allium, and aloe vera plus will also help in healing the gut. But then again, I recommend that you do some lifestyle changes that I've mentioned there. Avoid lying down, because being horizontal makes the reflux worse. And then identify and avoid trigger foods. Avoid over-the-counter painkillers as far as you are able. And also look at your diet and see what could be making things up for a healthier diet, and smaller portions at meals. Then another question related to blood clots. So this was systemic clots. This can, so people who get the blood clotting in vessels, which is not supposed to be. Blood clots are normal, but they are only normal if they occur in a site of injury. So when blood clots occur in the blood circulation, it is not a good thing. It tends to run in families, or it can be brought about by the use of certain drugs. For some people, it is artificial contraceptives can actually increase the risk of formation of clots. Some people who have COVID can also contribute to abnormal blood clotting, and also people who smoke nicotine can increase or worsen this tendency. So on the lifestyle side, we recommend that you increase movement and exercise in the lifestyle and eliminate problematic foods from your diet. Opt for healthy foods, minimally processed. Eliminate factory fats from your diet. Rather use the healthier fats, which support your blood health instead of worsening it. Then the supplements for blood health here once again come into play. We recommend lipotropic adjunct, omega-3 salmon oil, garlic allium complex, and magnesium complex. So for systemic blood clots, lipotropic adjunct, omega-3 salmon oil, garlic allium complex, and magnesium complex. But again, I will reiterate, if you are seeing a doctor and you have been put on blood thinners, you need to disclose this and to discuss with the doctor how you are going to work with your supplements and your blood thinning medication. Then another question was about malfunctioning bone marrow. It's not clear what the way in which the bone marrow is malfunctioning. It could be that it's affecting the composition of the blood, but this can be due to different reasons. So maybe there is an underlying reason. It could be exposure to certain toxins. It could be the reaction to cancer treatment, chemotherapy, or it could be as a result of an autoimmune disease. So try to get to the bottom of why there is the malfunctioning of the bone marrow. And as you do so, Neolife supplements can help with vitamin B complex, multimineral alfalfa, and Pro Vitality. Okay. A question about liver cysts. So cysts are fluid and that may appear in the liver, and they may sometimes just be someone is born with that tendency, or certain viruses that hide, certain parasites that hide in the liver can actually cause liver cysts. So eliminate sugar and junk food to minimize pressure on the liver. This will include things like factory fats, processed carbohydrates, and all this stuff. Take them out of your diet because they give the liver a lot of very hard work. Remember, when the liver is already having issues, the liver is the main detox organ in the body. And if it is having issues, then what you do not want to worsen the situation by overloading it with a lot of toxic stuff in your diet. So eliminate those problem foods, rather eat food supportive of good health, minimally processed, and so on. Also, if you're a person who uses alcohol, then the liver does not need to have the extra work of detoxifying for alcohol. So eliminate alcohol use if you have liver cysts. Then we recommend that you use chelated zinc, beta-GAD, and multimineral alfalfa to support the health of your liver and to see if you'll be able to resolve those cysts. Of course, if you suspect that you have been exposed to parasites, then it would be a good thing to have that investigated. Then someone wanted to know what to recommend for dizziness. So sometimes it's not very clear whether we are speaking about dizziness or vertigo. So dizziness can be the feeling of someone wanting to faint, while vertigo can be a sensation of imbalance that happens when there is an issue with our balancing organs, which are located inside our ears. So as this was not clear, my first recommendation would be try to identify the cause or to see your doctor in order to find out if there is an underlying cause of the dizziness. So, for example, anemia, that is low red blood cell count, can actually contribute to dizziness. That is a sensation of fainting. Things like vertigo, because I'm not sure whether the dizziness is dizziness or vertigo, but vertigo can be related to ear infections that interferes with the organs that may help us to maintain our balance, so that we may start losing balance. So try to investigate what is behind this dizziness. And we recommend multimineral alfalfa, recommend vitamin C and vitamin A plus D. If you are able to find what is the underlying cause, then maybe you can ask the question again with more information. Then another question was a person who has arthritis, prostate inflammation, and type 2 diabetes. Again, sometimes we look at these inflammation illnesses and we think they're a separate thing, but a lot of time they could be linked to what is we are taking in our diet and the lifestyle habits that we have. So if you are having issues such as these, the first place to look is the diet. Minimize processed foods, especially carbohydrates. Eliminate junk, eliminate factory oils. All these drive inflammation in the body, the unhealthy type of chronic inflammation that is behind a lot of lifestyle and autoimmune illnesses. So we have products that will help, of course, and these are highly recommended. So for the health of the prostate gland, we very much recommend Cruciferous Plus. In fact, we recommend it as a product that men should make, one of them, middle-aged men, make it part of their regular supplementation. And then for diabetes type 2, we are going to recommend Botanical Balance, which is going to help with managing blood sugar to bring it to a normal level. And we also recommend Provitality, which will round up the supplement well. So Cruciferous Plus, Botanical Balance, and Provitality. Then someone wanted to know what to recommend for ovarian cysts. So again, this is an issue which is related to sugar metabolism in our bodies, ovarian cysts. So the first place again is to eliminate processed foods and drastically reduce refined carbohydrates from the diet and avoid factory fats. And opt for healthy fats and make the majority of your food minimally processed. So foods that do not have a lot of additives and chemicals and whatnot, so that in that way you don't have these abnormal growths appearing in your organs. So we will recommend, again, Cruciferous Plus, a very important supplement for giving the body what it needs to deal with these abnormal growths. And then we also recommend Herbal Feminine Complex, because the ovarian cysts can either be linked to or bring about hormonal imbalance in the ladies. We also recommend Botanical Balance, because often sugar metabolism is what is driving the ovarian cysts. And then Trianen will be the other one that we recommend. So Cruciferous Plus, Herbal Feminine Complex, Botanical Balance, and Trianen. The hemorrhoids was the next one, and this is an issue that comes about if we start having what is this thing now? It's got out of my head. Constipation. Sorry, I had a senior moment there. So if we have got constipation that has been going on, and we do not have to it, eventually, as a result of the pressure caused by trying to pass stools, we may end up with hemorrhoids. And so the first thing that we recommend there is to look at your diet, ensure that it has got plenty of soluble fiber. This will come from your vegetables, it will come from your fruits, and it will help to loosen the stool so that it is easier to pass. And then, of course, maintain good hydration by drinking plenty of water. And on the Neolife side, we'll recommend supplements that help with the consistency of the stool as well as the ease of passing the stool. This would be stage 6. Fiber tablets is the next one, and aloe vera plus. So hand in hand with looking at your diet and ensuring your diet has got plenty of soluble fiber in it. And then adding to that, you'll be able to avoid exacerbating the problems that are related to hemorrhoids. Unfortunately, if the hemorrhoids have become very severe and are now protruding from the anus, it may be necessary to get help from your doctor. Either they may have to have a surgical intervention, or they may provide you with suppositories that can be inserted to assist you with healing from the hemorrhoids. But again, as I've said, this is a problem that does not appear suddenly. It's a problem that comes as a result of neglecting to attend to constipation. So if you notice that you are not regularly passing your stools, that is not a good thing. If you are eating, you should also be passing stools. And so if there is constipation or issues of that nature, please take it seriously and change your apples, vegetables such as kales and spinach and so on. Maybe if you're able to tolerate beans, you can soak and cook beans very soft so that they do not cause issues with the digestion. And these types of food are quite helpful in loosening the stool. Okay, the last question, I think, will be one that we again are receiving fairly frequently, and this is nasal polyps and congestion. So someone has a stuffy nose and they have growths, another has growths in the nose. And these growths in the nostril can be due to chronic irritation of the nose. The chronic irritation can be as a result of inflammation of the sinuses, that is sinusitis, or it could be as a result of allergies and an asthmatic condition and so on. So these tend to be related. And the lifestyle things that we recommend is rinse your nostrils twice a day, especially after having contact with allergens. So for example, if you have got allergy towards pollen or dust and so on, then at the end of the day, rinse your nostrils so that you reduce the amount of allergens that enter into your system. And then we also recommend to try to identify and avoid allergens if you are able to do so. There are certain foods also that worsen our allergic reactions and may need to be avoided. These are foods such as wheat and dairy. For many people, people may have other foods to which makes this worse, but wheat and dairy tend to be a culprit for many people who have got allergies. So you may try to eliminate them for a while and see if your symptoms are getting easier. The thing here is that if you have allergies and so on, even if the polyps are surgically removed, the problem is that since the allergy has not been eliminated, then you can still continue to have this nasal congestion and other polyps might once again grow. So the supplements we recommend is to help the body to resolve the allergic reaction itself, together with those lifestyle points. So we recommend flavonoid complex, we recommend omega-3 salmon oil, herbal respiratory complex, and vitamin C. So those will be a recommendation for people who are suffering with nasal congestion and nasal polyps related to sinusitis, allergies. So flavonoid complex, omega-3 salmon oil, herbal respiratory complex, and vitamin C. So I see that the time has got away from me. So allow me to thank you very much for having spent your time and your data in this time of sharing this Q&A. I hope that we have given value for it. And just in case you had a question that is pending and you are hoping that we tackle it today, I just want to encourage you, because we'll continue to do these Q&As until the end of the year when we take off for the holidays. And that way, I think we shall be able to touch on what you have asked if we did not touch on it today. I also continue to encourage you, if you have you want an urgent attendance to your question, that you can send it directly to me. My numbers are usually available with your DSC people. So thank you very much. I see that Pascal is eagerly standing by to take you through the next session. Let me wish